The relentless escalation of healthcare costs has become an alarming crisis that demands urgent attention and systematic reforms. The burden of exorbitant healthcare expenses is crippling individuals, families, businesses, and entire economies, pushing them towards the precipice of financial ruin. The unchecked rise in healthcare costs not only undermines access to essential medical services but also perpetuates profound social and economic disparities. It erects insurmountable barriers, preventing the most vulnerable populations from obtaining adequate care and jeopardizing their well-being. Furthermore, the skyrocketing healthcare costs place an immense strain on government budgets, diverting substantial resources that could be allocated to education, infrastructure, and other critical societal needs. The perpetual cycle of escalating expenses perpetuates a broken system that prioritizes profit over the fundamental right to affordable healthcare. Addressing this crisis requires comprehensive measures that target the root causes of inflated healthcare costs. It necessitates a paradigm shift towards a healthcare system focused on prevention, efficiency, transparency, and patient-centered care. It demands robust regulation and oversight to rein in the excesses of pharmaceutical companies, insurance providers, and healthcare facilities that exploit their monopolistic positions. Moreover, investing in healthcare infrastructure, fostering innovation, and promoting competition can pave the way for cost-effective treatments and improved outcomes. Collaboration between public and private entities, coupled with data-driven approaches, can drive efficiencies, eliminate waste, and optimize resource allocation. It is imperative for governments, healthcare organizations, and society as a whole to unite in their resolve to confront the crisis of escalating healthcare costs. Failure to act decisively not only threatens the health and well-being of individuals but also undermines the fabric of our communities and hinders progress towards a more equitable and prosperous future. Therefore, we must summon the political will, allocate the necessary resources, and enact bold reforms to curb healthcare costs and ensure that affordable, high-quality healthcare becomes a fundamental right, accessible to all, regardless of their socio-economic status. Only then can we pave the path towards a healthier, more equitable, and financially sustainable society for generations to come. Here are 45 ways you can do to manage the skyrocketing healthcare costs. Review your state and private providers' health insurance coverage and understand your benefits. Research and compare different health insurance plans to find the best fit for your needs and budget. Explore government assistance programs for healthcare, such as in rural or municipal health units, Medicaid or the Children's Health Insurance Program, CHIP. Contact your healthcare provider or hospital and inquire about financial assistance or payment plans. Negotiate medical bills with healthcare providers and hospitals. Consider switching to a generic version of prescribed medications to save on costs. Research and compare prescription drug prices at different pharmacies or online platforms. Utilize prescription drug discount programs or coupons. Investigate whether you qualify for patient assistance programs offered by pharmaceutical companies. Take advantage of preventive care services to avoid costly medical treatments later on. Seek out free or low-cost community health clinics for routine checkups and minor medical needs. Consider joining a health-sharing ministry as an alternative to traditional health insurance. Look for local or national charitable organizations that provide financial assistance for healthcare expenses. Explore crowdfunding platforms as a means to raise funds for medical expenses. Research and apply for grants or scholarships specifically designed to help individuals with healthcare costs. Consider using telemedicine services as a cost-effective alternative to in-person doctor visits. Research and compare prices for medical procedures or tests at different healthcare facilities. Ask your healthcare provider for lower-cost alternatives or generic medications. Explore options for medical tourism, where you can receive treatment in other countries at a lower cost. Investigate whether you qualify for state or local programs that provide healthcare subsidies or assistance. Look for free or low-cost mental health services in your community. Research and apply for clinical trials or research studies that provide free or discounted medical treatments. Seek out health education programs that teach self-care techniques to manage and prevent medical conditions. Consider utilizing mail-order pharmacies for prescription medications to potentially save on costs. Review your medical bills for errors and dispute any inaccuracies. Explore health savings accounts, HSAs, or flexible spending accounts, FSAs, To save on healthcare expenses with pre-tax dollars. Research and compare prices for medical equipment or supplies from different vendors. Seek out free or low-cost dental clinics for oral healthcare needs. Look for community programs that offer free or low-cost vaccinations or immunizations. Utilize free or low-cost preventive screenings and tests offered by healthcare organizations or local health departments. Investigate whether you qualify for subsidies or tax credits through the Affordable Care Act (ACA) marketplace. Seek out financial counseling services to help manage healthcare expenses. Research and compare prices for medical procedures or treatments in different geographical areas. Consider joining a healthcare sharing ministry as a cost-sharing option. Explore alternative therapies or complementary medicine options that may be more affordable. Research and utilize online resources or apps that provide healthcare information and cost comparisons. Investigate whether your employer offers wellness programs or incentives that can help reduce healthcare costs. Look for free or low-cost prenatal and maternity care programs in your community. Seek out support groups or organizations that provide assistance for specific medical conditions. Research and compare prices for vision care services and eyewear from different providers. Consider using home remedies or over-the-counter medications for minor illnesses or injuries. Look for free or low-cost exercise and fitness programs in your community to promote overall health and prevent chronic conditions. Investigate whether you qualify for any medical expense tax deductions or credits. Explore generic or store brand healthcare products and supplies as a more affordable alternative to branded options. Seek out health education programs or workshops that focus on preventive care. Thanks for watching. Please like, share and subscribe.